That's happening. Perfect. I have some poll questions to share. And we're counting on your participation today. So there should be 3 poll questions. And for those on YouTube and those on Facebook, hi, how are you guys? Hope you guys are doing great. So 3 questions. What do you think? And can you see the polls? Yes, no?
Yes.
Okay, perfect. Thank you. Thank you, Jen.
Yes.
Coming through. Thank you, Sinclair. So what is the most abused substance by you? Is it alcohol? Is it Delta 8? Is it fentanyl? Are you not sure? Is Delta 8 derived from hemp? True? Or is it false? And fentanyl is an opioid, 50 times stronger than heroin, manufactured illegally as pills, or all of the above. So for those that are watching live on Facebook or the recording, those are the questions. So we'll share the answers momentarily. And the majority have answered. So let's end our poll here. All right, so let's share these results. This is just to get started. Hopefully at the end of the presentation, hopefully we all learned something. So what is the most abused substance by youth? 45% said alcohol. Fentanyl was second with 27%, then Delta 8 with 18%, and not sure with 9%. Is Delta 8 derived from hemp? 73% said true, 27% said false. And then for fentanyl, what is it? 73 said that it was all 3 an opioid, 50 times stronger than heroin, and it's also manufactured legally as pills. And then 27% said it's an opioid. All the answers we'll discuss throughout. So thank you again for participating, much appreciated. And let's get started. National Drug and Alcohol Facts Week. A lot of us are providers, a lot of us are, and it's a really great week for us, right? We get to work with our youth, our community, share information. So what is it and why do we celebrate it? So this year, National Drug and Alcohol Facts Week takes place this week, March 21st to March 27th. It is to shatter myths. If you see in the logo, it says right there, shatter myths. It's to give honest and accurate information to the community, right? We want to give the truth to the community. And speaking of community, we want the community to be more aware of the issues that are related to substance use and addiction, and we want them to be involved. We want to work with the community, and we want the community to work in substance abuse prevention. If you want to learn more, you can always look up National Drug and Alcohol Facts Week, and it is National Drug and Alcohol Facts Week. These are our 3 subjects. These are our 3 substances we'll touch on today. We wanted to share some facts, right? Makes sense. So first, with alcohol, did you know that an excessive alcohol use leads to more than 95,000 deaths each year in the United States? This is total, it's not just youth. So that's a pretty big number for something that is, legal and attainable, right? And pretty accessible. Also, men are more likely to binge drink than women. I can vouch for this. When I was in college, men did tend to drink. Everybody that I knew tended to drink. Delta 8. Delta 8 is not FDA approved. It is not FDA approved. And then also the National Poison Control Center, they're reporting almost 1,000, 968 to be exact, Delta 8 exposures reported within the last year or so, year and some change, from January 1st, 2021 to February 28th, 2022. So almost 1,000 cases of exposure. Those are calls to the National Poison Control Center. And then lastly, fentanyl. It's a synthetic opioid that is 50 times stronger than heroin, 100 times stronger than morphine, and then 136 people die every day from an opioid overdose. Those are just some facts that we wanted to share, some facts, again, for this week for the community. But now we'll touch on each subject and each substance individually. I will pass it to Paris. So go ahead, Paris.
Hello, everyone. I'm Paris, and I'll start off with what is alcohol. So, it's a substance derived from yeast in fermentation, which we also known as fruits and grains. We also see this production in beer and wine. Alcohol is an aesthetic to put the brain to sleep. Currently, I am taking a substance abuse class, and I learned this fact that originally alcohol was used to treat pain, but today we will see with that when an individual is drunk, they're known to stumble or easily fall asleep. It is also a depressant that can lower your blood pressure, respiration, impairs muscle coordination. Alcohol is also by far the most commonly abused substance among teens and adults, and this is because it is easy to access. 61% is how much drugs we use among eighth graders between 2016 and 2020. 62% of teens in 12th grade have abused alcohol. 50% of teenagers have misused a drug at least once, and this is also because a lot of people have relatives that's close in age with them, so it can be easy to get alcohol in the house or use their ID to go and buy alcohol from the corner stores. Youth who drink alcohol are more likely to experience school problems such as higher rates in absences or lower grades. And this is because it can be hard for them to get on track once they have started abusing alcohol. They can develop social problems such as fighting or lack of participation in youth activities, and more so just becoming introverts and kind of going away from their friends. Legal problems can also occur, such as driving or physically hurting someone while drunk. With this, it is easy for teens to catch DUIs. That is also common, which results in car crashes and death, and physical problems such as hangover or illnesses. Early initiation of drinking is associated with the development of alcohol disorder later in life. And also, this can turn into a chronic illness disease that it results in cirrhosis of the liver.
Any thoughts and comments? I know I feel like a lot of people came in because they wanted to hear more on Delta A and fentanyl, but why alcohol? Any thoughts and comments on what was shared by Paris? Well, at least for me, I think bringing alcohol to the conscious, again, to the community, I think it's kind of a forgotten substance. I've been to most of the off-sale sites in Inglewood, so liquor stores, markets, little marts, all that, etc. that sell alcohol. And I hardly see any WeID signs for alcohol. I almost never see it now. I see tobacco, for vaping, but I don't see that much from alcohol. And and it being an issue, it's still an ongoing issue. I mean, I'm not that old, but I had a friend in college that all he wanted to do was party and drink, and he got into academic probation. He didn't change his ways. He got kicked out of our university, and he went back. I think it was like 3 or 4 or 5 years later. He had to apply again, and he graduated eventually. But there's real consequences. There's access. But I see Richard has his hands up, so I'll let him talk. Go ahead, Richard. Thank you.
Yes, thank you, Marlon. I just want to say that, in Carson, around 80% of our youth used to use alcohol. So yeah, definitely is the number one. But through all the work that we did in education and policy work, we were able to bring that down to around 20%. So we still have to deal with the liquor stores who give them to the kids. That's why. So I'm just letting you know.
Thank you. Yeah, I saw an ABC report to CAPA, for those who are familiar with the California Alcohol Policy Alliance. And they had a report from the Super Bowl, which is in Inglewood, and that's the city that I work in. And I think they cited a couple minors with open alcohol beverages and some other things with minors as well. So it's still an issue. It's an issue in our communities. But Richard, I'm glad to see that number dropped. I know a lot of it has to be with the work that you're doing with the community out there. But thank you for sharing. I appreciate that. If there's no further comments and thoughts, then we will continue. And now Delta 8. So Delta 8. So I like The Office. I see this meme all the time on Twitter, and I can hear Pam's voice saying, it's the same picture. So here I put a picture of Delta 8 THC and Delta 9 THC. And if you're looking, it looks pretty much the same, but there's like a slight difference on the top left, right? From Delta 9 THC and Delta H THC. So it's similar structures. So they're considered like familiar, they can be cousins or they can be siblings or whatnot, but they're definitely related, and you see the structure is very similar. So the difference is Delta 9, the THC that we come to know, the THC that gets you high, you know, the THC in cannabis and marijuana, that THC is derived from cannabis, and there's a lot more of it in cannabis, right? There's a lot of it. And the THC is, and Delta 9 THC is a lot more potent, so it's a lot stronger. Delta 8 is derived from hemp. And then it's also in the hemp plant, it's produced a lot less. So if you want to get the Delta H THC, it has to be extracted from a concentrate. Why? So concentrate. So why share that? So why is it important to speak on Delta 8? So on some recent surveys and studies, they show that smoking marijuana in traditional means is decreasing among youth, whether it's bongs or pipes or blunts or whatever. Those type of means is decreasing among teenagers. What is increasing on the consumption of marijuana is by edibles and vapes. They're using vapes and having edibles to consume marijuana, and that is getting a lot more popular among teenagers. So we talked about Delta H THC has to be from concentrate. So because it has to be extracted from concentrate, consumptions of Delta 8 is more common via edibles and vapes. So if you look at the picture in the top right, that is a Delta 8 vapes. So there's wedding cake indica, pineapple OG sativa, and rainbow kush hybrid. So as we know, marketing to your youth is always the colors, it's always the fruit flavors, right? But here we have Delta 8 as vapes. And in the bottom right, you see the gummies, is Delta 8 gummies. So that's how a lot of the consumption with marijuana in general, but that's the consumption also with. So going back to the National Poison Control Center report, what are they saying? So the Delta 8 THC product code, so when someone's calling and they're sick or they're poisoned, the THC, Delta 8 THC tag was just added last year, January 1st, 2021. So this is very recent. 40% of the 2,362 exposure cases to Delta 8 THC was unintentional. It was by accident, right? So it wasn't on purpose. So 40%. And of those 40%, 82%, so the vast majority of that number were unintentional exposures that affected pediatric patients. What does that mean? 17 and younger. Kids and teenagers. They're the ones unintentionally affected and exposed to Delta H THC. That number turns out to be around 775 in about a year. Right? So that's what? 365 times 2, it's about almost 2 a day, 1.5 to 2 a day, unintentional exposure to Delta H THC affecting pediatric patients. And then Delta H THC, as we're saying, is psychoactive and intoxicating. It gets you high. If you don't believe me, if you go to YouTube and you put stoners Delta 8, you'll have a lot of channels like these. These guys that's all they do on their YouTube channel, and they're saying that Delta 8 gets you high, and they all say yes. So if the people with the high tolerance and high consumption of marijuana, Delta 9 THC, is saying Delta 8 THC is getting them high, then you can imagine for those that are not used to it or barely being exposed to it. So again, with the FDA, this is not FDA approved. FDA states specifically, so I'm quoting here, manufacturers are packaging and labeling these products in ways that may appeal to children. Gummies, chocolates, cookies, candies, like the pictures we just saw 2 slides ago. These products may be purchased online, as well as a variety of retailers, including convenience stores and gas stations, where there may not be age limits on who can purchase these products. Because it's not FDA approved, it's not regulated, right? It's not treated as cannabis, as THC. So here in LA County, we have a work group, a coalition, Rethinking Access to Marijuana, RAM. AADAP is a proud member to be on RAM. So what is RAM doing right now? So they know Delta 8 is not regulated. So what are they doing? They're visiting different smoke shops throughout LA County to see if they're selling Delta 8. Smoke shops can't sell Delta 9 or cannabis products. But if there's a loophole with Delta 8, that's what they're doing. They're visiting these stores. Right now, they're in the process of gathering all the data, but there's some data that shows, and there's some stories that Delta 8 is being sold at tobacco shops. A lot of times tobacco shops are very near high schools and middle schools and parks, places that are youth free. So that's hopefully we can have a report soon from RAM because this is very important. And as you see, even the National Poison Center is barely registering Delta 8, right? So this is something that's newer, and it's something RAM jumped on and we're trying to get done. So shout out to RAM. Appreciate the work everybody's doing there. Any thoughts and comments with Delta 8? No thoughts and comments. We're just absorbing the information. I like. Now I'll pass it back to Paris. We'll be talking a little bit about fentanyl.
Over time, fentanyl has become an epidemic because their opioid overdose outbreaks has been happening everywhere. It is now considered a national public health emergency. Fentanyl is a synthetic opioid typically used to treat patients with chronic pain, but it is easy for minors to buy them on the street, as seen to the right. They can be sold in Ziploc bags. They are 2 different blues, and they each can have a different stamp engraved into them. They have been also illegally manufactured as pills, but it can also be in a powder form. It has also been involved 59% of opioid-related deaths, according to the recent study by the National Institute on Drug Abuse. Here is the research that we did that is talking about youth and fentanyl. So there is multiple different stories. A 17-year-old that has died just from contacting someone on social media. There has been recent headlines as of this morning, and all of these articles have happened within the last 6 months. A 12-year-old has also been charged for fentanyl overdose. Many youth actually have no idea what they are taking, and they can be commonly mistaken as Xanax bars or Percocets. So to be clear about the risk, fentanyl can be tasteless and odorless. It is the size of a grain of salt, can easily cause an overdose. And as seen on the right, it says that a lethal dose of fentanyl is compared to the size of a penny. And even in the little containers, you can see that it's not much fentanyl in there that can cause an overdose. Substances are laced with fentanyl long before they reach friends, dealers, and friends of friends. Teens that's who they trust also supply them.
Anybody from the audience would like to comment or share their thoughts? Well, fentanyl is a problem that's growing at an exponential rate. Those headlines that we shared were not even from a month ago. Paris and I were looking today, and there was something from 4 hours ago posted, 24 hours ago, 4 days ago, 5 days ago, 6 days ago, new schools, new states, new cities. Like they're reaching our schools. Here in LA County, you might hear a lot with like the homeless population, right? The opioid overdose deaths. But the reason, we're speaking today and kind of sharing is if there's any parents watching, to kind of learn a little bit more, because pretty soon it's going to reach our schools here in LA County. It got to San Jose, it got to Fresno, it's been in San Diego. I even heard like in Sacramento, there was like a 5-year-old girl. It's important to talk about it. Right? It's important to bring the awareness of what is fentanyl and how these youth are accessing. I did a workshop, or it was a training on fentanyl, and they're saying that it's not even like, kids that are constantly using drugs that are overdosing off. The ones that think they're like getting something else, that don't use drugs, they trust their friend. They said this will help you study, or this will help you calm down, this will help you this or that. And the drug dealers are, using social media to do that. I think someone forwarded me an article saying that Snapchat's finally trying to do something to battle this problem. Last month at BHS and the beach cities had a fantastic workshop on this, on fentanyl. They had the Hermosa Beach Police Department chief speak on it very candidly about what's going on in one of the cases. He said he was breaking his code, but that's how important it is to bring awareness on fentanyl. It's very dangerous, it's very potent. And it's something that's becoming prevalent across the country. Not sure if anybody else would like to share any thoughts or comments on fentanyl today. Not, that's okay. We'll start wrapping it up. So I don't know if there's any questions in general or across the presentation. If you want to ask about the research we've done. Paris has a unique experience. She's taking a class that you mentioned earlier at Dominguez Hills. That gives her another perspective. So is there any questions for today's presentation? No? All right. Well, I will ask for 3 volunteers. So we got time soon. 3 volunteers. It's National Drug and Alcohol Facts Week. Here's a poster from a youth coalition in Inglewood in their poster contest last year. So this is from an Inglewood High School student. But we want to know, and we would like to hear from the audience, what is your takeaway of today? And why is it so important to talk about this and having National Drug and Alcohol Facts? So we'll wait for 3 brave. Schools should provide education about fentanyl to students. I'm in agreement with you. So Shanti's put it in the chat. Schools should provide education about fentanyl to students too. And some education at the schools. Some schools across California have resources on fentanyl. What is fentanyl on their school websites? I forgot what schools, but I did see a couple. Go ahead, Richard. Thank you, Richard. I appreciate you. Go ahead.
All right, Marlon, National Drug Facts Week, if we were on campus right now, think about it, a whole week where you're doing activities, something fun, but also something educational and engaging with the youth. It's National Drug Facts Week. I think is very important because everybody is concentrating on the week for being awareness education. Not just us being prevention community prevention organizers, but even the school and the students, they've known about it, they know about it. So yeah, that's what I like about National Drug Facts Weeks. When I go out there, different classes in the quad and doing all kinds of events and activities. Thank you, Marlon.
Thank you, Richard. So we had 2. We had Shanti, we had Richard. We need one more. One more volunteer. Thank you, Shanti. Shanti also put in the chat that he learned more about Delta 8 and fentanyl today. So thank you. So one more volunteer. Who's it going to be? Here we go. Thank you, Kai. What would be a good approach if teens still desire to use drugs? How do we take on a situation with keeping them safe and educating them on mixing drugs and alcohol? Any trainings available? For here with AADAP, we have a youth outpatient center. So that's actually where the community prevention office is inside the youth outpatient center. They're great. A lot of this, when it factors on why the youth want to use alcohol or other drugs, it could be something related on mental health, right? Whether it's fitting in or they're trying to cope with some type of trauma, et cetera, et cetera. So that's what our youth outpatient treatment center does here. So they do mental health services, they do substance counseling, substance treatment, they do group therapy. So I think having an approach with kind of understanding the reasons why, and when providing those services and speaking to them, I think there's a lot of different providers, great people out here across LA County that can help. I'm not sure what area you're in. It's definitely connecting and working together, to service our clients, to help our communities, especially our young people, right? So I know I'm not addressing it maybe like directly, like give you an answer directly, but I would say you see what resources you have within your agency and your partners. And then that way, you can provide those resources to youth, and making these schools always also help having that general education. And I saw Jen's hand first. So Jen, go ahead, and then I'll take Richard's question.
Yeah, Kai, I want to comment on Kai's question. Something that has been proven useful is being able to connect it to young people's values, and being able to like how their use will impact their values and really understanding what they value, right? Because that's the thing too. The things that you might value, they may not value. And so if you start talking about things that you value, they may say, okay, but because that has nothing to do with their values. But when you can understand what their values are and then being able to connect the impacts of their drug use or substance use to their values, then that can definitely help in getting them to decide to make a change, or to at least consider the fact that maybe, I shouldn't be using drugs. Maybe I should make another choice. And then the other thing too, I'd say is like to reference Marlon's point about like different providers and different things. There are a lot of like workshops and resources and things that happen. We send some out through our growing prevention list. So if you put your email in the chat, then I can put you on the list. And then if there are workshops or things that come up for you that you're interested in attending, then you can just attend those. And we also include like the Hot Topic Tuesdays and other things that other agencies are doing as well. And then also, Erica is coordinating a workshop next Wednesday. Erica, you can talk about it. On the 30th, so that's Wednesday, for college students from 4 to 5 p.m. And it's focused on, it's focused on marijuana. And so I think that's also another great way to, Erica just put the flyer in the chat, another great way to get more information and resources to be able to support the young folks that you're working with.
I appreciate that, Jen. I think that was great insight. The values of the youth. That's true, right? That's what matters to them. Another service that we have in AADAP, early intervention. So maybe the youth is not necessarily for counseling or treatment, but they have a case manager, someone that maybe just started using or was exploring or something like that. So it's in between prevention, where we provide the information for the youth and for families and whomever else in the communities. So yeah, and growing prevention is fantastic. I got the email today about the different workshops and opportunities that we have, not just in the South Bay, but throughout LA County. So thank you, Kai, for the question. Richard say, why are youth so into drugs? Is marketing, influence, or access? Again, depending what they're going through, if they're trying to cope with something, or is it pure influence? I think it's depends on the youth. You know, I had a bunch of friends that did a bunch of stuff when I was in middle school and high school, and I didn't partake. So I think it really depends on the youth and what they're going through and their personal experiences. But it could be peer influence. It could be, like I said, coping. There's other, you know, situations. So I think it depends on the youth, but definitely the more information we can share, you know, hopefully the best decisions everybody can take for themselves. Erica's commenting on, you know, why is it important for National Drug and Alcohol Facts Week? It's important because teens are susceptible to making impulsive decisions. Yeah, like using to be cool or to fit in, not knowing the dangers. So one thing that we didn't mention today, but we mentioned a lot of times is the youth brain development. That to me is always going to be the main reason why we focus on youth. The frontal lobe starts developing around age 15, ends around age 25. That's the part that makes decisions and controls those impulses that Erica was mentioning. So it's definitely important to give them the information so the youth are equipped with that. And again, hopefully they make the best decisions they can. And we offer other support and services and resources. Thank you, Erica. I appreciate it. I think we have a lot of participants, and then please check out the flyer that Erica posted. Again, we're working together, so we definitely want to promote the different opportunities. So thank you, Kai. Thank you, Richard, Shanti, Jan, Erica, and everybody else who participated today. We appreciate you. Before we leave, we'll look back at the poll questions. Let me stop sharing and pull them up. Rashane. So here's our post test. If you guys could do me the favor or do us the favor of answering, we would appreciate it. Again, for those that are watching online, what is the most abused substance by youth? Is it alcohol? Is it Delta 8? Is it fentanyl? Are you not sure? More participation. The second question is Delta 8 derived from hemp? True or false? Fentanyl is an opioid, 15 times stronger than heroin, manufactured legally as pills, or all of the above. So if I have half the participation, another 10 seconds or so, and then we'll wrap this up and continue with our day.
Question, while you're waiting to do the poll, I wanted to ask Paris, like, as a college student, what are you hearing about or seeing or experiencing when it comes to substance use with folks your age?
Well, actually, I just went on campus for the first time in 2 years because of COVID. And I actually explained to Marlon that I was walking down the hallway and I seen a guy vaping. But for me, I believe that it is a norm for us, and maybe we are using it as a coping mechanism just because college can be stressful. I don't partake, but just seeing that day, it was everyone's first day being back on campus. I just took that he was very overwhelmed from that experience.
Thank you for sharing.
Thanks for the question, Jen. I guess I'll put a plug in. So we have a podcast, Prevention 365, and Paris and I will be on it tomorrow at 9 a.m. And she does mention a little bit about our college experience. So thanks for the question, Jen. Reminding me to plug that in. All right, so here's the results from the poll questions. So post test, what is the most abused substance by you? 80% said alcohol, 70% said 8. Is Delta 8 derived from hemp? 92% said yes, 8% said false. And then fentanyl is an opioid, 8%, and then 92% said all of the above. I want to thank everybody for attending, for listening to what we had to share, for participating. We greatly appreciate it. So we thank you. And yeah, and that's pretty much our presentation. So we'll say bye to Facebook and bye to YouTube as well.